everyone, this is Janet Gupta with the Scottsdale Institute. Happy New Year, and thanks everyone for joining us. Today's topic will be leveraging digital transformation for provider success. And this exciting topic is going to be led for us by Dr. Sapna Ravula. She is the Chief Medical Officer at EXL Health. And EXL Health is an organization that helps organizations deliver on the promise of an improved consumer-centric care and really a more innovative approach to tailoring messages as well as achieving better outcomes through a digital transformation strategy. I'm sure that we have lots of interest in this topic, as well as we'll want to engage in a good conversation as we walk through today's webinar. Before I turn this over to Dr. Ravula, I'll point out a couple things. One is that we are going to do some polling questions, which I think will be fun, just to get your feedback as well on where you are on your own digital transformation journey and what you've been experiencing. And also that we'll ask you to post any questions that you have as a result of this conversation using the Q&A tab at the bottom of your screen. And I will pick those up at the end of today's webinar and make sure that we get those asked and answered. So at this point, I'm going to turn it over to Dr. Sapna Ravula from EXL Health. Thanks for being here, Dr. Ravula. We look forward to your comments and to talking to you about all of the exciting things in store. Thanks again.
Hello, everyone. Happy New Year. Thank you, Janet, for the warm introduction, and thank you, Scottsdale Institute, for this amazing opportunity. I am Sapna, a family physician by training and a data enthusiast by choice. As Janet mentioned, I currently serve as the Chief Medical Officer of EXL Health. Now, most of you may probably have never heard about EXL Health, and that's okay, because that's what I'm here for. But I guarantee you that what most of you have heard about is the call for a purpose-driven life. And now, by extension, we are all leading data-driven lives. All of us are here today because of that common thread that binds us all. We love healthcare and we love data. It is basically just as simple as that. The purpose of this webinar is not to overwhelm you with data or information that most of you will never remember probably once the webinar is over, but merely to provide you with a minimum of tools and resources that will help you gauge your own digital transformation journey, analyze where you're headed, and perhaps help you plan your next steps for a successful healthcare future for all of us. During the next 1 hour, we will explore the evolution of digital transformation and specifically how you can tie frameworks of what you've already built and to develop insights that you hope to gain. I hope to make this a fun and interactive session. Feel free to light up the chat as we go along. To start off, I wanted to get a sense of who in the audience considered themselves to be a provider. And it sounds like a very simple question, but it can be quite involved.
Looks like we're getting a good response to this, and I think we probably can go ahead and end the poll and let you comment on that.
Thank you. Okay. So we have 26% considering themselves as providers, and a whopping 72% as no, and 2% is unsure. And, thank you, the unsure people, because, it makes me very excited to present to you the next slides. This is a patient journey. This is a provider journey. I want you to look at both of these images very carefully. I want you to think about how much effort and care the creators of these journeys may have put into these. But why do these slides look so busy? Why do these images look so busy? That's because we lead complex lives. Everything we do is complicated. Transforming our four-dimensional empathy that we bring to our healthcare every single day into a two-dimensional journey is not easy. Now, regardless of how hard every single one of us may have worked at some point or the other in our careers in creating these digital artifacts, it is undeniable that there is obviously a disconnect between these two. Providers care about patients. Patients don't think of themselves as patients. Providers want to provide care. Patients want everyone else to value what they value, their lives, not their bodies, not their minds. And I must add this, not their data, but their life as a testament to their unique journeys. Now, regardless of which side of the microscope we all land on, it is undeniable that we all share common interests and common goals. We want to improve well-being and we want to reduce costs for all. Given this, let me introduce you all to something that I am passionately promoting at our organization, a culture of data clinicians. Why is this important? Because we are moving from direct patient care to longitudinal consumer care. Because whether we are impacting our patients' minds, bodies, or their data, we're technically all partners with one mission in life. And this is where I think we must all ask ourselves, and I think the 2% would agree with us, are we providers or are we facilitators? Are we patients or are we consumers? So however we refer to ourselves, we are all here for one mission, and healthcare is now evolving into life. And this is how my mentor, Sam, helps us all focus on data-driven insights to bring practical solutions for everyday problems. And so now that we've all warmed up with the first question, here's your next question. Okay, this is wonderful to see. So I see 4% fully prepared. I want to meet and learn from you. I want to see the 76% who are saying that they're somewhat prepared, and 20% are nowhere close to being engaged. Well, looks like regardless of what stage we are in, looks like 100% of us are past the stage of denial. So that's good news for us. And interestingly, the very creation of this question is a commentary on the disconnect we were talking about earlier. We love to think for our patients. The real question should have been, how prepared are we to embark on this journey? And I'm trying to move to the next slide. And so, welcome to the Industrial Revolution 5.0. And no, that's not a misprint. While everyone is trying to get 4.0, a lot of us have already envisioned and implemented 5.0. That's because what took over 200 years for the mechanical and the electrical revolution now has just taken 50 years for the digital revolution. And it still seems like a roller coaster ride to most of us on any given day. And unfortunately, due to the scale and to the speed, and I know, forgive me, I speak very fast. I've been accused of that before, so let me know in the chat to slow down if you need me to. Unfortunately, due to the scale and the speed of the digital transformation, this looks like a mess that we created. And I say this with all due respect, respect. We are with good intentions, but this is what it looks like. Every time I hear a new term such as cyber physical stream or a digital twin, I have to search Web 2.0, and Web 2.0 is smarter than me, obviously, and it keeps telling me to go to Web 3.0. And so for all of us who are either unsure, traveling on this journey, this is how we cope with it. We are using these fantastic terms during our 10-second desk lunches or the highly stimulating intellectual parties that we attend and used to attend in another lifetime, it seems like. We overuse them, we misuse them. And now this slide is not about me giving you a Wikipedia spit out of what each of them mean. I just want to focus on the last one, digital health. HIMSS spent a lot of time, energy researching what digital health actually means. And guess what they found? They were able to find 7 different ways to define digital health. 7 ways to define digital health. Talk about the power of data. So Oracle did a fantastic job of predicting the future. Let's see, between 2015 and 2021, it's amazing to see how comfortable. We all are with the B word, that's the billion word. Everything is in billions these days. There are 50 billion internet devices for a population of 8 billion. And I want to point out to the second column here, where we have these very sophisticated customers. And I don't want to add any more poll questions, but you will see where it's the commonly used word is about me, consumer, it's all about me. Remember, however you choose any of those terms, disruption, innovation, however you use it, remember that technology is just a means. Undeniably, it is also at the core of your ecosystem of which you are the provider or the facilitator. And the reason understanding why this is important becomes more clearer, because in order to fully digitally transform either your products or your services, you have to be very clear on your ecosystems. What is your business model? Who are your customers? What drives your growth? How are you operating your business model effectively to solve the problems that you set out to solve? Watch carefully for the different levers, business driver levels, business enabler levels. It's all about finding the right balance. So we have established we're all from healthcare, however we refer to ourselves. Our ecosystem is that of a healthcare ecosystem, and let's focus on the digital transformation specifically in healthcare. One of my favorite mantras in life is every challenge is an opportunity and every opportunity is a challenge. So this slide and the next slide will aptly demonstrate how opportunities can be changed into challenges and how challenges can be changed into opportunities. So none of these statistics may surprise you. What should engage you is that number at the bottom, the 3.3 trillion that is being spent annually on healthcare costs. And these are the challenges. If we look at the percentage of chronic diseases and wonder how we are ever going to solve any of these, how we're ever going to have a healthier nation, and look at the exploding app growth, every single day there's a new app coming out, and every single app promises things that we never even dreamed possible. Don't get overwhelmed. I try not to. Just reset your minds, because mindset is everything. And at EXL, we like to say, look deeper. I want you to look deeper for the opportunities. I want you to look deeper at how other providers are leveraging their digital investments. 50% of the providers are investing in robotics. 20% of patient interaction will involve some form of artificial intelligence. According to IDC, 65% of the world's GDP is set to be digitized by 2022. And here we are, 2022. I would be very interested to see what their updated information looks like. Together, we are all set to invest over $6 trillion into this digital transformation by 2023. And when I say us, all of us, most of us here are significantly contributing to these $6 trillion investments. Now, you may be wondering why I keep talking about billions and trillions. There is a point to it, because I want to emphasize that it is critical to not just get excited about digital transformation. It is more important to focus on industry trends and gauge where to invest these resources. The pandemic put a lot of pressure on telehealth, and we did a fantastic job. We've had virtual ICUs, we've had people gear up to rural areas, we've saved lives with telehealth. However, notice how in the future, there is an engagement towards downsizing from the investments into telehealth and diverting those resources into AI ML. And if we don't learn to refocus the lens, we will continue to drain our resources. The pandemic has impacted all of us in this healthcare ecosystem. Look to the right of the slide, read through those challenges. How many of you are getting crushed by these challenges? And I bet if we were live, I would be seeing a lot of heads nodding. So do light up the chat, folks. Share with each other how hard these past couple of years have been. And if you have any more challenges, put it up there as well, because we want to share this journey. We want to be part of this together. So coming to poll question number 3. Now that we're all experts in our polls,
I have a feeling this one's a hard one to choose from because it's probably all. So glad you forced it to say which one is the biggest challenge. We'll see what people say.
I really want to see who picks E. All right, so here are the results of the poll. We have people dealing with system issues, 13% dealing with systems, 38% with people, 38% with processes. That's interesting to see how there's an even split between challenges from people and processes, 9% with finances, and I think this speaks directly to the previous slide. 4% extrinsic factors. I really want to learn about these extrinsic factors some more when we get a chance. Thank you everybody for participating in that. My slide share is getting stuck. Sorry about that. Anyway, now, most of you already know interoperability and omni-channel, and this is what we've been doing. We have been bucking up, chugging along, let's make this happen attitude. Interoperability, omni-channel, and personalized medicine. These are the buzzwords for everybody who's involved in digital transformation. And do not ask me to explain this slide, because I bet most of you feel like this as we are dragging along our legacy systems, duct taping our hardware, code taping our software. Personally, I feel like this is an alopecia scalp map of my future, or for most of us pulling our hair out, just trying to get through the stage of digital transformation. So just wanted to put that in there because it was so cool. Now this slide I like. Whether we're talking multi-channel or whether we are talking omni-channel, this gives emphasis to how overwhelming this whole process can be and how much we are inundated by various channels. So whether you're on the multi-channel or whether you're on the omni-channel journey, at least we've all learned together how to put one individual at the center. Now this icon specifically relates to a provider because we're talking about provider success. You could replace that with a patient and make them just as successful. So I want you to forget everything that we've learned in the past slides and just focus on AI. AI is the last piece of the puzzle. AI ties omni-channel with interoperability. It predicts positive consumer outcomes. And this is what we're all talking about: personalized predictive medicine and actionable intelligence. So, is digital transformation the key to digital health? So we have business models, we talked about consumerism, very important to talk about partnerships and strategic alliances, and which is why I keep repeatedly using the word ecosystem. We are all in this together. So if I have to ask the question, and I'm not going to pull you on this one, is digital transformation the key to digital health? I would say that digital transformation is not the key. You are the key. You who understand your ecosystems, you who know your business models, you who have committed a lifetime towards serving everyone who passes through the doors of your facilities. You are the key. So before we embarked on the digital transformation journey, this is where we spent most of our lives, in silos of states. We were either well or we were sick, we got better, or we were on the way to get better. And it's important to understand how this links to the next slide and how ecosystems are evolving. And this is how we look at our journeys now while we are undergoing digital transformation, because the amount of data that is being generated is overwhelming. A lot of the struggles have been to categorize the source of these data, to categorize the types of the data. How do you asset classify these data, and how do you put them in actionable, intelligent models? And this is what we deal with a lot. And remember, we talked about how converting our four-dimensional empathy, that love and care that we bring to our patients, how do we transform that into a two-dimensional view? And so add to that another 6 dimensions of AI, because obviously it's much more smarter than us. This becomes a humongous overtaking. All right, so poll question number 4.
This is probably another one of those where people want to pick all. So it'll be good to, again, force a priority ranking. So glad you did that.
All right, the results are in. Thank you, Janet. So 47% of us are focused on patient outcomes, as it should be. 19% are on operational optimization, 3% in futuristic insights, 3% in raising health equity, and 27% in consumer satisfaction. And I think this is fascinating, and I think this is extremely important to focus on, because everything drives into each other. Ultimately, it's all about the outcomes for the consumers. And again, patients, consumers. Let's see if we can convert some of those 3% or convert some of the 47% into the 3%, because that 3% is going to help you achieve that 47%. So let's take a look at these goals. So we've all spent some time analyzing what each of us want out of this digital transformation journey. So let's take a look at these 8 goals. Do we want to manage population health, quality, digital transformation for access, resource optimization, utilization review, create a contact center? It's always the small things that count. We forget that, answer at your first ring. That's a very small thing, but answering at that first ring, make sure that your patients or your consumers are always happy and are always coming back. Small things matter. So regardless of where you are in your digital transformation journey, if any of your goals don't resonate with these 8 goals, I would urge you to look closer, because this is what the other providers are doing, because everyone else is thinking in these terms. Now, here I want us to take a pause and think about the famous oxygen analogy on the flight. Put your mask on first. So we're all very good at taking care of our patients, because that's how we all grew up. We get into healthcare and we're all gung-ho about making a difference in the world. And nowadays, we have learned to evolve to speak about patients as consumers. But are we taking care of ourselves? Are we financially healthy? And this is why when we look at this pyramid of evolving KPIs for healthcare, financial valuation becomes the base of that pyramid. Empowering yourselves to drive better insights, to help funnel the best of who you are, to bring the best of the care and that you want to provide to everyone in your ecosystem involves a great deal of financial stability. And it's critical that we start thinking and talking in those terms. So let's talk, we talked about digital consumerism and financial health. I'm not going to go too much into clinical well-being. We all do it. We do it very, very well. Digital consumerism. When we talk about digital consumerism, are we really only focused on enhancing the experience and reducing the friction? So any one of these, these are some things that you may have already implemented or looking towards implementing. How we do this depends on what drives our business models. Go back to one of the previous slides where we talked about the organized way between analytics, operations, and digital transformation. But go back to your ecosystem and think about what is your business model. Outpatient care doesn't necessarily mean outpatient care. How you have set your outpatient care means different things for different people. What are your consumer demographics? What are your specialties, areas of care? What is your mission and vision for your ecosystem? Focus on that. Now, look at this list and think about which of these do you want to focus on first? How do you customize and prioritize any of these tools to bring about better outcomes? Now we have 47% of our audience wanting to bring better outcomes. We can't do all of these all at once. However, we can build models which will help you prioritize which one of these to divert your resources to and focus your energies on. Insights will help you, but first you have to know your business models. You have to know your people. Let's talk about financial well-being. Each and every one of us as providers have to put on that oxygen mask, think about how we are improving the performance of value-based contracts, increasing cash flow, capturing revenue, preserving working capital, etc. Here's that famous slide again, the points of care and the types of care, and it's overwhelming. It is. just having to build this slide out and just having to make sure that we didn't forget anything. And I'm sure there's things that fall off of this, but every single one of these is a data touch point. And every single one of them not just creates one type of data, it creates a multitude of types of data. And so this becomes your data value chain. And this is where you start re-envisioning your frameworks, everything that you've set up, your legacy systems that you've upgraded, your operational models, all the frameworks that you worked so hard to build. Now let's start looking at how we're going to gain insights out of these. This is a data pyramid. So we want to look at how we are aligning the data that you're generating, and that's a lot of data, and then follow the principles. There's only two simple principles that you must follow: apply and analyze. To the left is the analytics, where you analyze, and to the right is the application, where you apply. And that's it. That simplifies things to a great deal. We want to predict, yes, we want to see how many of our consumers are going to come back for their well-child visits. How many of our geriatric population are going to be readmitted? We are interested in all of these questions, but do not forget that even though you may have all the data, how are you going to apply it? How are you going to bring back those lessons that you've learned? This is a spectrum of digital transformation solutions. When you're looking at these categories: data and analytics, clinical services, customer experience, revenue optimization, the CFO services, digital automation. These are all categorized into what are the services that are available for providers who are interested in their digital transformation journey. However, it is not important to walk through all of these journeys at the same time. Do you just want to focus on nurse triaging and patient access? Do you want to buffer your back office services? Do you just want to focus on your customer optimization? Do you just want to focus on your financial well-being? And all of these unique needs is what you need to work with your data partners on, helping you prioritize. All right, poll question number 5. Are you dealing with legacy system changes? And it's okay to pick third option, by the way. All right, so we have 67% saying yes, 10% no, and 23% still undecided. And that's okay. We don't know because technology is changing so fast. How do you define a legacy system? And this is my favorite way to approach a question. I question the questioner back. How don't you define it? That obviously drives them crazy, but it makes everybody think. So sometimes we get bogged down by what we don't have, and we forget to look at what we already have. Those are the frameworks that you have. And it's okay to work with what you have to start working towards where you're going. I was just quoting this morning, the journey of 1,000 miles begins with one simple step. Let's all start walking together. Let's take that first step together. So whether it's legacy systems, whether it's your consumers who may not be technologically aware, it doesn't matter if you build $1 million app, if a lot of them don't have access to mobile phones or internet. 3 billion of the world's population has no access to internet. And so we are constantly questioning ourselves because we put our conscience at the forefront. So look at this slide and think about how you can simply simplify yourselves. Use what you have to get to where you want to go to. Use analytics and operations in toggle with each other, balance them out. Remember, it's all about balancing. Start with your data-driven insights, ensure quality, be consumer-centric, and build agile operating models. These should be your 4 mantras. And each of these are possible regardless of what kind of systems that you're working with. All of them are possible if you have the right data partner. And so in order to do so, this should be your AI journey. And I show this because I want to ask a very interesting question about artificial intelligence. So where on this journey do you think you are currently? Are you creating a data center? You've upgraded your systems. Every single one of you have your cows and whatever. Are you on cloud computing? Are you digging deep into artificial intelligence, machine learning? Are you focused on analytics and insights? Are you employing automated robotics? Some of the surgical centers have exponentially advanced in their robotic services. But again, that goes back to the original slide where what is your demographic? What is your mission and vision? How are you guiding yourself to provide these services? What does your roadmap look like? These are all just tools, the chatbots, the search inquiry, the mining, the natural language processing. And I have an interesting story about natural language processing that I was just sharing with Janet earlier and would love to share with you all. So remember that earlier slide where we talked about analyze and apply. I have simply broken that down into 2 slides. So this slide will deal with how you analyze, the next slide will deal with how you apply. So that's the amount of data that you're pulling in from the data pyramid, the bottom of the data pyramid, your lab data, your EMR data, your provider data, prescription claims, everything, eligibility, nothing is left out. And we process it through systems that create profiles for you. Then we want to get 360 degrees of analysis. We want to gain insights into where the gaps are. We want to analyze how to prioritize areas of impact. So if you have that checklist that we've been going through previously, it's very useful to let our models predict where to prioritize, because then we focus on actionable intelligence, prioritize with your outcomes, and give you better return on your investments. And again, there's the 47% that we wanted to talk about outcomes, and those are the outcomes that we can all talk about. So that was the analyze portion. This is the application portion. Now, everything that we've learned, everything that we've done, we need to implement. So there's that engine that's working in your operating models. Are you infusing digital to enhance your operations? Are you utilizing your staff well enough? Are you overstaffed? Are you understaffed? Are you not distributing your staffing appropriately to the needs that are arising? Are you looking at call center operations? Are you automating every single workflow that goes through your facility? Analyze and apply. So if you can't or don't want to remember anything that we've ever talked about, this is a very, very simple checklist for all of us to go through over here. Are you employing cloud-based data strategies? Do you have chatbots? Do you have conversational AI? And again, the omni-channel, I do love that slide. The interoperability, not so much. Analytics and reporting automation and improving value-based care performance. And this has become a very common buzzword. And I am sure there are more to add to this checklist. So we have Adam on our team on the other side of the chat. So feel free to drop some in. This really helps bring more cohesiveness around everything that we are all trying to do. So poll question number 6, and luckily the last question. Just want to see if I have not put everybody to sleep over there. Okay, so we have the results of the poll number 6. 38% have stated that they are lagging behind the curve. 58% say they are on par with the curve. 4% feel that they are ahead of the curve. And I've been prompted that I'm not answering this question. I apologize. But I just want to warn you folks, I am a huge Matrix fan. And I really want to say this. I wanted to say this. There is no curve. So that's, I've been trying to say that for a long time now. Because here I have something that puts everything into perspective. So that's the AI train. And we're all waiting and watching and super extremely excited about the AI train. So I have news for all of us. The AI train has left the station. And I say there is no curve. I really like that movie. But AI learns at an exponential rate. AI doesn't learn the way we learn. AI learns within itself, from everybody else. The database that AI has is amazingly huge. So while we can sit here and predict how AI is going to grow, and then we can predict all of it, AI is just going to blow us away. If you look at that little dots on the right side, the graph on the right side, the capacity of an insect brain versus mouse brain versus one human versus the entire human population. 2020 is so if you miss that AI train, don't feel bad. There's still ways of getting back on this trajectory, because I'm pretty sure people who drew out this trajectory, AI is going to prove them wrong as well. But the whole point is that there is no way to predict how AI is going to grow. So use your investments wisely. I am not asking everybody to just jump on the AI train. However, ensure that you are prepared for the future as well. Start working on automating of some of your workflows as far as possible. For the 7% who are working with financial constraints, use your investments wisely, because this is what across the board providers are focusing on. Program identification, referral, they're aggregating data, member data, EMR data, and then they're using it to predict risk, how they can intervene, how they can automate some of these processes, compress the data, set individual goals, and then create tools. Take a moment to look at this automation workflows and see where you can buffer up all your efforts and help out each other. Again, partnerships and strategic alliances. I'm a big believer in the entire ecosystem being very successful together. So just to give you an idea of the power of automation, this is one slide I like to brag about. 582 Autobots have been deployed across the healthcare value chain, whether it's patient, member management, provider services, life sciences, healthcare management, claims, everything. 582 intelligent Autobots. That's an incredible amount of brain power. To me, family physician, I feel like I've stumbled into the data wonderland, and I am constantly in awe of how much progress we're all making together. So here's my friendly tip of the day. Find a data partner, not just a digital partner. Your ideal data partner should be your trusted collaborator. They should be implementing a data-driven approach into everything that they're bringing to the table. If they're not talking data, you're not prepared. We need to be industry focused, apply governances, controls, quality, compliance, follow the trends that are going along, tag your journey with the industry trends. You don't want to be away from the swim lanes. You want to be ahead in the swim lanes, but you want to be in the swim lanes unless you are implementing something completely cutting edge, which I would love to come and hear about. Practical design, make sure that it's actionable and make sure that it makes sense to your consumer. Is it making sense to that little boy who's walking into your pediatric clinic? Is it making sense to the grandma, that broker? Does it make sense to the families that trust you as their provider? And again, I emphasize strategic partnerships and alliances. Help each other be successful, because that's how we reduce healthcare disparities. And you all, everybody on this call has probably an IQ pool of over 10,000 at this point. We all have superior talent in our organizations. Value your talent, make them feel empowered, make them feel like they belong. It's all about people. No matter which way we look at it, we're all in this together. And so find a data partner who will help you be ingenious. Find a data partner who will make you shine, because the right data partner will help you innovate through collaboration more than anything else, and respect. That's very critical. So my job is done. You will have access to all the information on all of these slides, and you can read through them when you're going through those moments of social isolation in your offices at home. And you wonder about the days in the past, but hopefully we will turn the curve and we will all be able to meet in person. So thank you, Janet.
Oh, this is awesome. Thank you, Dr. Ravula. Fun conversation and lots to explore. So we've got some questions coming up in the Q&A tab, and we've also had some questions in the chat. So let me just bring up to everyone's attention some of the questions that have already been asked and answered. A lot of questions around where do we get a hold of the slides and the recording. So if you go to the Scottsdale Institute website under webinars, you can see the link to the slides, and that's also where the recording will be posted. And there was a terminology used, IVA, which stands for Intelligent Virtual Assistants, which is really around this notion of chatbots. And I know there's been some conversation in the literature about what's in chatbot and IVA. So I'll let the folks here comment on that. And then there's a couple other questions in the Q&A tab. So let me go to the Q&A tab for a minute and remind people that if you've got questions, you can either jot them into the chat or you can jot them into the Q&A. The Q&A tab is easiest for us to keep track of. So if you don't mind going there first and just jotting your questions, that would be great. Let me ask a couple of the questions that have been addressed in the Q&A tab, if you don't mind, Dr. Ravula, and let's chat about them. The first one comes from Dr. Michael Shabbat, and he's on our board and has a detailed background in this whole field of clinical informatics. And he says, a paper published in JAMIA this week quantified clinical data on interoperability between EHRs from the same vendor versus between different vendors. The results were dismal, as you might imagine, he says. And how do interoperability limitations affect digital transformation? Is that something you want to tackle, Dr. Ravula?
Yes. Oh, yes, Janet.
Okay.
I think that's a very good question. Jumping on the bandwagon with all good intentions. We all have positive intentions on how we want to help out our patients. And I remember my first job was as a hospitalist, and I loved it. I just enjoyed being in the hospital. We were just at that point, the early 2010s, bringing in various EMR systems. And oh, by the way, since I wanted to make it more challenging for myself, I opened up a clinic. I did a lot of research on how to implement an EMR in my, really small 2-room clinic. Spent a lot of money on it. I didn't talk to anything or anybody. But it was fancy. I really loved it. So when we are talking about one small clinic dealing with the challenges of the EMRs over there, and this was way back in 2011, now we look at these massive systems that have built in terabytes and whatever bytes of data. There has to be a cohesive, collaborative approach, wherein the government does what they can do. However, we have to collaborate with each other. We work on FHIR systems, HLA7 systems. We work on trying to integrate languages that talk to each other. And there are ways of extracting, compressing data that we can use to leverage. By the time we come to a point where we can have these systems talk to each other in live, I would guide you towards, how should we say, Horizon 3, where blockchain is just around the corner. And we've talked about this at Harvard, where I did my business analytics course. A lot of us are hoping that blockchain may help solve some of these answers, but in the meanwhile, tackle it the best you can, find your data partner, and we can take this offline as well. And I have some ideas that I can share with you. Thank you for the question.
Yes, and thank you. And as a follow-up, maybe, you talked a little bit about this whole, the interoperability and access to data and analytics. And frankly, there's a lot going on just in that definition of data analytics, and it can be overwhelming. So, where do you even get started? What do you think is sort of the place to start on addressing this overall question?
I personally believe in data decentralization, wherein we help bring the power of the data back to the individual. Currently, industry trends are moving towards data consortiums and the data aggregators. We have some very, very motivated organizations around the country and around the world trying to tackle these very similar questions. The GDPR rules in Europe have made it very, very clear we need to put the power of the data back into the individual consumer. And again, following the industry trends where the future is will help a little bit, but start with the data consortiums and try to partner with folks leading towards data decentralization. And again, this becomes easier to communicate with each other. We all talk about the future, and that's why I put that slide in. The AI train has left. We missed it. All of us, in all good intentions, we missed it. But we still have a chance if we do the right things for the right reasons. And so that's where my biggest push is towards helping empower the ecosystem.
Well, fun. Obviously, this is a big topic and lots more to talk about. Let me switch a minute to another question that showed up in the Q&A tab coming from Amy Porter at Texas Health Resources. When you say that there are 582 intelligent automation bots that have been deployed or established across the healthcare value chain, what's the source and basis of that number? So if you don't mind explaining a little bit about what are those different bots and how did you quantify that?
And this is where I really wish I had a technology background, and I am a family physician. I always say I'm your friendly family doc down the street. But our technology team, our analytics team, again, analyzes everything that they're doing. The way we work is with our partners. When our partners have specific needs and they want to automate some of their systems, we leverage technology in such a way where we find models which are created that we then deploy. And again, before I completely ruin everything, I'm going to direct you to our technology department, who's probably nodding and shaking their heads, and they're like, Dr. Ravula, don't, we're here to help you. But we're definitely going to connect you with our really stellar technology folks and analysts on our end.
Fair enough. We can pick that up in a minute. So let me switch to a couple other questions that are, again, in the Q&A tab. We're hearing from Brent Steinekert at Sharp Healthcare. For the people challenges, changing culture from a call us to let me show how to self-serve, what tactics do you suggest are most effective to help frontline physicians and staff who are worried about the patient making mistakes become advocates for patient digital engagement?
I just love that question. And again, we try to think for our patients. We want to ensure that they don't make any mistakes. It's like parents, where we childproof the house. And we have to learn to be trusting of the resilience of our patients. They are learning and growing at a much faster rate. And they are growing in the digital transformation era. A lot of the patients coming in may have, there was an article in New York Times where a young lady was asked how she would pick her ideal life partner. And she said, I'm gonna ask Siri. So Siri has become a friend. And this is where the conversational virtual assistants become the core of our existence. I would say trust your patients. They do know how to take care of themselves. They are trying. The mobile phone is the most powerful tool that you can put in anybody's hands. The 18,000 healthcare apps that have been set out there, they're not just there for fun. There are teams, hundreds of people have worked on these apps with the right intent, trying to help these patients find the right outcomes. I would say trust a little or start a focus group. And I love focus group. I have a public health background, so I'm all about going directly to the source and asking them, how can we help you? Help us help you. And people like that. They like to have those conversations. And now you have tools where, you can do it virtually. So get feedback, open that loop, open the dialogue, ask them what they want.
Well, that's helpful. So thinking about that question and your answer, I'm also going to read the next one that's on the Q&A tab, because you're talking about really sort of listening to the consumers, trust the consumers, bringing tools to them that are meaningful and in a format that's simple like the phone. And I pick up a question here that says, how do we close the gap between provider technology sophistication and the consumer, which is the consumer has been influenced and has expectations set by Amazon or Netflix. So do you have some hints and tips there about how to close that gap?
I love Amazon. I purchase everything on Amazon. However, I say Amazon has ruined the customer experience for all of us, the sense of expectations. And I know exactly where that question is coming from. I've lived that life. I come out of my residency, I set up my practice, and I have this fancy new computer and I have a fancy new EMR that I spent my first paycheck be working in a hospitalist on, and I'm ready to go. And patients come in and they come in with printouts of everything. They know their differential diagnosis, they know what tests they need, and they know what the next step should be, what the intervention should be. I learned at a very early stage in my life to adapt. So we could have the technology and the means to close the care gaps, to improve patient engagement on the front end, improve patient engagement on the back end. But then how effective are you at communicating in that 15 minutes of time that you have? There's a lot of studies that say that, doctors don't even look at patients, the providers don't even look at their patients, don't make eye contact. So you know what I did? I would take my laptop in there, I would sit there and say, come on, let's talk about this. And then I would go to the source that they went to empower them and say, I validate what you've searched. Here's what I always say. I hear you and I'm here for you. So two very important things that we must remember. So, and it's not possible to do it all the time. However, making people feel heard, they will jump that gap for you. Trust me on this, trust your patients. They will come to meet you if you show them that you're there to meet them. And you can be open about it. You can say, hey, I don't want 5 stars. Give me 3 stars. As long as you're healthy, it's okay. But the pressure is too much on the providers. It is very hard. I empathize with you. I hear you. We don't all need to be 5 stars on all days. Trust me, I've had my 2-star days and I've had my 0-star days. And it's okay. Talk to your patients and say, hey, today I'm having a 0-star day. They'll make it a 5-star day for you.
Fair enough. Well, we have a hand raised by Stacy DeShiel at IU Health. Stacy, do you want to ask your question directly? Stacy, if you'd like to unmute yourself, you're welcome to ask your question directly. Well, we'll come back to you, Stacy, then. Let me move on then to a question that's in again, the Q&A, which is coming from Megan Morris at Honor Health. Previously, you mentioned about blockchain, and I see we've got a little bit of interest in this whole topic of blockchain in the chat as well. But Megan asks, I think your mention of blockchain is interesting. I think of blockchain as valuable to healthcare documentation. For example, in the non-episodic model of single chart creation of a lifelong health record. What are your thoughts about that? And what are your thoughts about the use of blockchain in the way that you addressed it?
And yes, you're absolutely right on the stage at which we are. So the episodic capturing of data points into the blockchain, and that's the starting of the building blocks itself. However, there are other technologies that can be leveraged, and I don't want to give all my IP away over this webinar, whereas you build the foundations of EMR on the blockchain itself, leveraging other technologies into the back end to, I'm going to give you a word, tag your data and then connect those data points, because the integrity that you find, the immutability that you find with blockchain technologies then you leverage it and you send your tags, data tags, and then you pull it all back together. And that's where it becomes faster and faster. But that is Nobel Prize winning work. We're not there yet. 3 to 5 years is what we need to put into this. And again, partnerships and alliances, people who find common interests, reach out to each other. This is the most beautiful part of this AI journey that we are at. We're going to accomplish this together.
Well, that's exciting. This has been a great conversation. I've got a couple more questions that I again just want to sort of pull up from the Q&A tab as well as the chat. Where do you think this is going in the future in terms of this investment in this the chatbot, the automation, what kind of conversational AI technology or even application is? Where should we be headed on that? How are you thinking of the best use cases for this, or where do you think is the area to invest the most in this sort of intelligent automation of voice assistant?
I think this question should be diverted to that young lady who wants to find her life partner with Siri. I think, again, same thing. There's a balance between buzzwords on everybody has a chatbot. We are going to use a chatbot. There is a reason why a lot of these technologies are open source. And so making them open source helps people, especially very talented technology experts, find creative solutions for it. Chatbots, the way we see them now, may no longer be true in a few years or in a few months. We don't know. And that's where we talk about the trajectory of it. However, then there becomes the highly emotional investment of the fear of missing out. And if your consumers are used to having all these technologies from other providers, you want to be able to provide them with comparable services. And so it becomes a peer pressure, so to speak. And I think the more balance it out, listen to your consumers. What do they really need? Are they hungry? Are their kids going to school? And it's not just about finding the right technology solutions. It's about taking care of those people that depend on you so heavily in your ecosystem. So find the balance. You will know how to find the right balance rather than driving from a trend-based perspective. Listening to those whom you serve, that will guide you the right way.
And so here's a very specific question related to the same topic, again, coming from Brent Steinekert at Sharp Healthcare. What are your thoughts for what systems can create this emotional connection to patients using digital tools and engagement? So for example, should the bricks and mortar clinic staff thank the patients for using their tools? Or is there some other way to provide positive reinforcement?
It doesn't, I think that moment of connection comes regardless of which method you use. And so we could do retrospective studies on which of these have worked with the consumers, and then you will find a whole new host of focus groups. And then they will have different outcomes, different results, and different insights on how things have worked for them. The meaningful act of using thank you is, I think, the most important step. There is research on people have analyzed emails and seen organizations where organizations use the word thank you more number of times, or they've used smiley faces more number of times, and they've projected it onto the studies on how happy are the people who work at these organizations. So if you look at Google, look towards Google. Google has an open source for us to learn from their researches that they've done. How has Google helped keep their people happy? At least learn from the lessons, the good parts of the lessons that you want to take back to your consumers. So regardless of which methodology you use, taking that first step and combining a hybrid model of in-person and your automated assistants always helps. People cannot forget that there are people out there, especially, and this is very, very important question right now because of the social isolation, the behavioral impact of social isolation, and the mental health challenges that we're going to face. It doesn't hurt to have a real person reach out at any given time.
Well, we actually had more questions in the queue, but we're at the top of the hour. So this has been fun and fascinating, and we appreciate everybody who is listening, the questions that you've asked, and we want to be able to continue the conversation. So thank you for logging these questions here. We'll make sure that we simplify the process of getting your questions answered and addressed by our guest from EXL Health. So Dr. Sapna Ravula, thanks so much for being here today. We look forward to continuing the conversation.
Thank you, Janet. Thank you, everybody. Have a wonderful day. Thank you.
And thanks, everyone. Please remember to complete that post-webinar survey. We look forward to hearing everybody back again. And in the meantime, stay healthy and stay safe. Thanks, everyone. Have a great day. Bye-bye.